So, having seen the lecture on heart failure with reduced ejection fraction, we have a pictorial interactive session on this topic. So, the first is heart failure is due to contractile abnormality, relaxation abnormality, structural abnormality, functional abnormality. The definition itself, I told you, it is due to all the four which can produce heart failure. So, it is all of the above: contractile, relaxation, structural and functional. So, now I am showing you this stage 3, NUR autosuggestion 3. This dyspnea is what? Is this dyspnea at rest? The answer is no, because the dyspnea at rest is stage 4. And now I am showing the stages. I am showing you what is stage C. So, what is stage C in ACC classification? What is C? Whether the patient is symptomatic or asymptomatic. As you know, stage A, risk factors to develop heart failure. Stage B, structural heart disease with no symptoms and signs. Stage C is symptoms and signs. That means this patient has to be symptomatic. Stage C patient is symptomatic. Of course, stage D is refractory. So, I am asking you which heart failure in these two pictures, which is heart failure with preserved ejection fraction. So, the difference between heart failure with reduced ejection fraction and preserved ejection fraction is the ventricle. Small stiff ventricle, hypertrophied ventricle with dilated atrium is heart failure with preserved ejection fraction. Large ventricle with thin walls is a heart failure with reduced ejection fraction. So, our answer is likely to be 1 in this patient, because this is the typical heart in heart failure with the preserved ejection fraction. Small cavity, stiff heart. If the patient is able to lie down flat and sleeping nicely, and what is excluded? What is excluded is a severe left heart failure, because in severe left heart failure, patient will have orthopnea and will not be able to lie down flat if it's a severe left heart failure. And patient has got a pitting pedal edema. What condition does not produce pitting pedal edema? Here, right heart failure, pericardial disease, mixed edema or hypoproteinemia. The answer is mixed edema. And I am asking you, if you have the circulation in this circulation is lungs. When you have the pulmonary venous congestion, this pulmonary venous congestion will not produce what? Leg edema, PND or orthopnea. The answer is leg edema, because the PND or orthopnea